Lots of people are very focused on their due date. As soon as they become pregnant, they want to know when their baby's going to come. And so we estimate that. We estimate it based on formulas that were made long, long ago, but it gives us an idea of when your baby will be mature enough to be born. It's not a guarantee that your baby will come on that day. It's an estimate. And babies get developed at many different times. Some babies are a little bit happy to come a little earlier than that, and some really want to wait until a little later than that due date. And those are totally normal. As long as your baby is born after 37 weeks, we call that full term. And we want that little one to come out by 42 weeks because waiting any longer starts to become risky. If your baby stays in until very close to the due date, it will have the optimal amount of development. It's normal for baby to come anytime between 37 and 42 weeks. Some women have their period very regularly every month, and some women not so regular, sometimes miss a month or sometimes just don't remember when their last period is. We try to find out the first day of your last period, and it's calculated forward to 40 weeks from then, okay, which then is your estimated due date. Now we know whenever you started your period you weren't pregnant, but that is how the formula was developed. So typically you conceive about 2 weeks later, okay? If you're a person who can't remember your due date, don't have regular periods, or if you've had other health conditions in the past that would indicate to have an ultrasound early, they can do an ultrasound that measures the size of your little tiny embryo. So from its little bottom to its top of its head, and that's what determines the gestational age or your due date. The dates don't always match, but if your period date and your ultrasound date are just a couple days apart, what the ultrasound is doing is really confirming your due date by your period. Later in your pregnancy, when you have an ultrasound to check your baby's anatomy, they will probably calculate another due date. It will most likely be different from both your period date and that early ultrasound date. But again, the most accurate is from the beginning of your pregnancy, and so that's the date we keep.